patients?
Yeah, of course not. um, um, when I became an infectious physician, of course, that's what we are trained for. Not of a pandemic of this scale, but we were prepared to manage novel outbreaks. We were prepared, but as a medical student, no, we just want to be a doctor, and yeah.
Now that you have treated them, how do you feel? Like, do you feel a sense of achievement that you were able to kind of conquer this virus?
No, the story is not over yet, and we still want to end it, and we are still looking for better drugs. We are still doing clinical studies for drugs on how to use them, how better to use them. There is still a lot of work needs to be done, and the vaccination program helps, and I think our work will become a lot easier if people come in droves and get themselves vaccinated. I think we can move forward to look at other diseases if people could get vaccinated.
Dr. Suresh, pre-pandemic, you're an infectious disease doctor, but pre-pandemic, how was your day-to-day and how is your day-to-day now?
It's totally different. So we, of course, as you know, we as an ID physician, we manage infections. The biggest infection that we used to manage at that time before COVID was HIV and tuberculosis and dengue. These are three big diseases that I used to manage. We still manage HIV and TB as outpatients. We don't manage them as inpatients. We still have a clinics that we run. But yeah, I miss those diseases now because I'm losing my touch managing those diseases, and dengue, as you all know, the rates for the whole country is down, and yeah, totally different what I do then and what I do now. Right?
Do you long for the day when you go back to the HIV and tuberculosis patients?
Of course, I badly want to manage. I used to dread bad dengue patients, but now, of course, all of us, all ID physicians now long for those cases, because for the past 1 year we have been focusing on managing COVID. Yeah.
COVID just made everything else look like a walk in the park.
Yeah, correct. In a way, because there was no textbook for us to go to, and we had to write the textbook, and so yeah, it was difficult.
Has it in a way made you a better physician?
Yes, we as a whole, I think we have learned a lot. We have learned new habits. We have learned to work together as a team. We are doing a lot more research on the job. We are learning from the disease on the job. We are looking at the diseases a bit more analytical eye, because last time we just used to take guidelines and just apply them. We are now analyzing them better, and we have used digital technology more, and we are using telehealth clinic in our clinics a lot more, and so patients, many a times we manage patients through the phone rather than face to face, and so I think we have learned a lot because of COVID.
Doctor, and you were basically leading the charge for Sungai Buloh. How did your family take it?
Yeah, my children were at home. They were happy that I'm not doing a great job, so the school is still closed.
Did they actually say that?
And yeah, they've just started going to school again. Kids enjoyed that they don't have to go to school. There were moments of fear, because when I felt down and out, and I felt sick and all that, of course there's a lot of fear, but otherwise knowing that I'm an ID physician, they realized part of my job, and they were by and large very supportive.
Does it put them off from wanting to become a doctor?
They never were interested in doctor, purely because they didn't like the hours that I work. Even before COVID. COVID was not an issue. They didn't like the idea of being a doctor because the number of hours I put in at work, but not because of COVID.
How about potential future young doctors? Do you think the pandemic has the pressures of the job have put them off from pursuing medicine?
I mean, there are a lot of other issues with medicine with regards to jobs and contracts and the other issues that that number of doctors that are coming out and all those stuff, but that can sway the decision to become a doctor. But I feel COVID would have made it more popular, because it is not like, a lot of healthcare workers succumb to the disease to make it sound as if it's a very dangerous disease and all that, dangerous profession. I didn't look that way. So I think if at all the value of a healthcare worker in the society has increased. So I feel if at all the COVID should make more people want to be a healthcare professional.